Hi, I am responding to a query about how to safeguard the knee when going into flexion, into full flexion of the knee joint for people who have had injuries in the knee or who have detected some kind of weakness in the knee joint. And it is a transition state that can last for a very long time, and it can last for years, and maybe one will have to do it for the rest of their lives as they are going into full flexion positions like Baddha Konasana, like Virasana, and most importantly like Padmasana, which is not just a flexion but also a twisting action of the legs. And of course, there are more advanced leg positions like Kandasana and Mulabandhasana, which we will not talk about right now, but yes. So, all of the positions where starting with full flexion of the knee to flexion plus twisting of the knee, if there is a weakness in the knee, then these are extremely good both preparatory positions, and also while in the positions they safeguard the knee. So, this prop, this attachment can be kept on. We use a rope, you can also use a belt, but a rope is better because it has a roundness to it. Also the ropes are softer. The belt it feels too much like a sharp tug, and this is what we do. I will show you a couple of ways of doing this. I have just doubled the rope. So, now you have a nice thick piece of fabric, and please start by sitting on a height, and we wear this around the leg. And if you are going to do it with both the knees, then if you have two ropes, then you can wear it around both the knees. It is nice to do it with both the legs even if you have injury or discomfort only in one leg, because there is always a difference between the two sides, and one always senses something, learns something new by comparing one side with the other. Starting by bending the knee, and this rope goes behind the knee. So, I am using the rope to passively pull the leg up as the knee is going into a flexion. Yeah, so the muscles of the hamstrings and the quadriceps are not doing anything, my arms are doing all the work, and therefore, there is no tightening at the back of the knee of the ligaments and the other connective tissue in this process of flexion. So, they stay completely relaxed even though the leg is flexing. Now, from here, this other leg which we are not working on, please feel free to keep it however you want to keep it. Now, the ropes have been fixed into that gap between the knee. Now, we use this rope, the top strand, we pull on it in various directions, going all the way from towards the thigh side to going towards the shin side, and this is of course also working on the femur bone and the musculature of the thighs itself. In fact, it will also go into the hip socket. I am going to go down a little lower, so that when I do this action the knee actually has a chance to descend down to the floor, and as I do it, I have now locked this other end of the rope underneath my knees so that it does not shift. So, now I roll it like this. You can also sometimes sit on a height and also take a height for the foot itself. So, I have lifted my foot up on the block, and this will roll the femur further backwards into its socket, and then you can roll. Well, now I have had a knee injury, and my injury is actually on the outer corners of the knee. I therefore also like to pull on the lower strand of the rope. So, I also pull the outer edge of the knee out. But this action of just pulling the top strand, this is good for everybody because it rolls the thigh from the inside to the outside. At least in the context of yoga asanas, it is good for opening the hip for all seated positions like Baddha Konasana, Upavishta Konasana, Padmasana. This action is always helpful. And once this has been done for a while, I again go back to the same, like a rewind of how I had bent my knee, I am going to straighten the leg the same way. So, I lift the knee up, now I am holding it with both the hands and I straighten the leg, but I am supporting it completely with my arms, so that the back of the knee now gets to completely extend. Yes, so you can move it a little bit from the back of the knee towards your thigh and also a little bit towards the head of the calf muscle, and then release the leg down. And of course, what is done on one side has to be done on the other side as well. Let us look at a slightly different rope arrangement. This is also something that we were taught, but you can try both and see which works better. Okay, so the knot is coming from the inside and under the knee, and the loop side comes from the top, and it fixes into the knot. And so now we have got this free, only one free edge to hold, and again you can roll the thigh back, roll closer to the knee back, all the way into the kneecap roll and the head of the shin roll. And what is done on one side, of course, also has to be done on the other side. So, for safeguarding the knee, if you know that you are going to try Padmasana maybe after a long gap and you are not sure if your knee will hold up or not, then this is a good preparation to do. Spend enough time doing it, spend 2, 3, 4, 5, 10 minutes doing it before attempting things like Padmasana, Baddha Konasana, Virasana, etc. If you know you already have a knee injury, then these ropes can also be just kept right there. So, before going into a Padmasana, you can take one of these ropes, fix it behind the knee, and then just leave it there and then go into a Padmasana leg. This will maintain space behind the knee, so that the connective tissue there is not crushed. So, this rope can just be left there. It can also be left there in Baddha Konasana, it can also be left there in Virasana leg position. Thank you.